I recently met with Dr. Damon Tweedy, one of our esteemed faculty in psychiatry and a best-selling author. The COVID pandemic brought mental health to the forefront of the public conversation. And in 2023, the Surgeon General highlighted loneliness and isolation as a public health crisis. We talked about this and how the medical profession can address these concerns. For mental health resources at Duke, please refer to the information on the screen. Damon, thank you for joining me today to talk about behavioral health. So there was a lot of attention on behavioral health during COVID. What was your perspective?
Yeah, there's no doubt that the pandemic, really accelerated the mental health sort of crisis, as it's now called. I mean, people lost their jobs. They were, isolated from friends and family. All these sorts of things that we think about. There's great fear of the unknown. But I kind of think there's, looking back, there's probably kind of two, points to really think about. One is that these problems were, sort of preceded COVID. These issues of depression, anxiety, substance use, they really preceded the COVID pandemic. But what happened is the pandemic really accelerated the sort of things. It kind of put a switch on everything. And also, the process of being sort of in this sort of closures and the pandemic slowed things down in a way that people could sort of take it all in. We got to really see, wow, the system really isn't really working very well. I think the second point that really you think about is, COVID really showed the illustration, sort of like how, these medical and physical elements, physical mental health elements really sort of overlap and are interwoven. If you really think about that, because on the surface, COVID-19 is an infectious disease, right? It's a physical problem, right? But it has a real significant mental health toll that we're still dealing with today. And so I think, we have to sort of be mindful when we think about all sorts of diseases that there's a physical component, but there's also a behavioral mental health component.
So that's an important concept in education and how we educate doctors to understand that intersection. How can we do better?
So traditional kind of medical school psychiatry education model that I was under, you probably were under, I think in many ways it actually failed doctors and patients, in many ways. You're often in a hospital that's like a separate psychiatric hospital, or if you're a student, you're put in an emergency room, or you're in a locked ward on a general hospital, and all things that just make psychiatry seem sort of, it's kind of maybe even scary and just sort of different. The patients were sort of isolated. And I think it really does kind of a disservice, because I think what we really need to do is see people kind of in a different way. So it's also important to see that mental health, just like anything else, it's continuum, right? So people have these issues, but there are also, some people are doing really well. And so I think it really makes sense to have people, students, young doctors in clinics where they can see someone in what we might call remission or recovery. It really kind of gives you a sense of the whole person. So when you see that person who's in crisis, you can also imagine that there's this other end that this person might be able to get to. And I think the education system has kind of really failed us in that way.
So you incorporate behavioral health throughout the medical school curriculum?
Yeah, I mean, I think there's already, trend lines sort of pointing us in that direction. And so, primary care is sort of the obvious example, because that's where so many people kind of initially present, with their mental health problems to the primary care doctor. So there's definitely, initiatives there. But I think it really needs to go broader than that. I mean, you imagine a medical student in a diabetes clinic or a cardiology clinic, and why can't they work with a psychologist who maybe can, take them through the nuts and bolts of how behavioral health treatments can really impact the medical course of illness of patients in that clinic. And maybe if they've seen people in other settings do well, with mental health problems, maybe they might be more encouraged to talk to patients about, stopping smoking or drinking less alcohol.
So speaking of different settings, you practice at the Durham VA healthcare system. That's a different model for behavioral health.
The VA is really, near and dear to me in all sorts of ways. My grandfather was actually in World War I. I had 3 uncles that were in World War II, and an uncle in the Korean War. My dad was in the Navy shortly before the Vietnam War. And so, the VA has always been sort of near and dear to me in that sort of way.
Too.
So there's this perception, in many ways that the VA is a step or even 2 steps behind places like Duke and the private sector. But in this model of sort of integrating mental health into primary care, the VA has actually been a model of actually excellence in many ways. You think about the traditional model where people have a hard time getting access to care. They have to get these referrals. They have to go to another part of town. The VA model, we're embedded in the primary care clinic. ISAC has a large team of people who do this. It can really be life-saving if you really, if you think about it. There's one example I want to give you. So, many years ago, I was working in a setting where there was a man who was depressed. His primary care doctor took him right down the hall to see me. Only later, months later, did I realize how severely ill he was in that particular time, because he got better over time. But several months later, he confided to me that he was really deeply suicidal and that he'd made out this elaborate plan to kill himself. And that to this day, he'll say that seeing me that one particular date in the clinic next door saved his life. I think what's important to know is that, again, the VA was sort of ahead of the game.
Right.
And in more recent years, places like Duke and many other places are already starting to integrate this model into their own primary care settings.
Right. So congratulations on your new book. And I'm sure you've incorporated some of these ideas into the book. What made you write this book?
It actually all started several years ago. I was, a couple years back, I was actually at a class of medical students. We were on Zoom, and they were just talking about the distress that they were seeing among their patients, and also the ways in which mental health kind of remained marginalized and stigmatized, and patients weren't getting the help that they needed. And it really made me take a step back and sort of look back. How did we get here? It made me reflect on my own experience, my own journey, where I was also one of those doctors who kind of looked down on mental health and behavioral health when I first got started.
Congratulations on the book, and thank you for all that you do.
Thank you.